All right, today we're going to talk about something that a lot of us have probably heard about, but maybe don't really grasp just how serious it is. I'm talking about periodontitis, or what most people just call severe gum disease. And trust me, it's way more common and a much bigger deal than you might think. So let's get right into it.
So, just how common is it? Well, check this out. According to the National Health and Nutrition Examination Survey, a staggering 42% of adults in the United States have it. 42%. That is nearly 1 out of every 2 people. Just think about that for a second.
And, this isn't just a US problem. Far from it. When you zoom out and look at the whole world, the severe form of this disease affects a mind-boggling 743 million people. But here's what really gets me about this slide: the comparison. We're talking more people than are affected by diabetes, depression, or even asthma. It's a huge and honestly a seriously underestimated global health crisis.
Okay, so here's our game plan for today. We're going to define what this hidden disease really is. Then we'll get into the most surprising part, your body's overreaction. We'll look at the major risk factors, see how dentists figure out how bad it is, and then walk through the battle plan, both the first line of defense and the long-term strategy. So, first things first. Let's get a really solid handle on what we're actually dealing with here.
Now, the key words to pull out of this definition are chronic, progressive, and irreversible destruction. This tells you right away this isn't just about your gums bleeding a little when you brush. Nope. This is a disease that is actively destroying the very foundation of your teeth. We're talking about the ligaments and that specific part of your jawbone, the alveolar bone, that holds your teeth right in their sockets. And that brings us to, honestly, the most fascinating and crucial part of this whole story. What is actually causing all that destruction? I'm going to bet the answer is not what you think. This image here illustrates it perfectly. Periodontitis isn't just one thing. It's a perfect storm. You need 3 ingredients. First, the bad guys, the microbial pathogens. Second, a susceptible host, which just means your personal biology makes you more vulnerable. And third, you need risk factors. These are the things that basically pour gasoline on the fire. So, it all kicks off with a specific crew of bacteria, this gang called the red complex. And when they set up shop, they do exactly what you'd expect. They trip your body's alarm system. And that alarm, that response, is called inflammation. It's your body's natural way of fighting off invaders. So far, so good, right? Your body is just doing its job, trying to protect you. But what happens when that alarm system is kind of faulty? What if it goes completely haywire? And boom, this is the big reveal. For people who get periodontitis, their own body's inflammatory response is a massive overreaction. I mean, think of it this way. It's like having a few burglars in your house, and to get rid of them, you call in a demolition crew. The crew, your immune system, ends up causing way more damage, literally tearing down the house, your jawbone, that it was meant to protect. All that destruction, it's basically friendly fire from your own body. So, if the main problem is this faulty alarm system, what things make it even more trigger-happy? Well, that's where the major risk factors come into play. And man, can they speed up the damage. Okay, 2 things really stand out here: smoking and uncontrolled diabetes. Look at that number for heavy smokers, over 7 times the risk of bone loss. Why? Because smoking just messes with your immune cells, making that faulty alarm even more sensitive. And it's a similar story for uncontrolled diabetes. It alters your whole immune response, leading to more than 3 times the risk. These aren't just minor influences, they are massive accelerators. All right, so now we know what causes it and what makes it worse. So how do dental pros actually measure the damage? Well, they have this really smart system for classifying the disease. The first piece of the puzzle is called staging. The easiest way to think about this is that staging assesses the damage that's already happened. They're looking at how much the gum and bone have pulled away from the tooth, and they're looking at x-rays to see how much bone has literally disappeared. A higher stage, like a stage 3 or 4, just means more destruction has already occurred. It's a snapshot of the past. And the second piece is grading. Now, if staging is about the past, grading is all about the future. It's a prediction of how fast the disease is likely to keep going. Grade A is slow, B is moderate, and C is rapid. And look, see how those risk factors we just talked about, smoking and diabetes, measured here by blood sugar control, play a huge role? They can literally bump someone into a more aggressive grade. Okay, so the disease has been diagnosed, staged, and graded. Now what? How do we fight back? Well, the strategy starts by going right after the source. The first line of defense is a special kind of deep cleaning called scaling and root planning, or SRP for short. And believe me, this is not your regular 6-month checkup cleaning. The whole point is to get deep down below the gum line to physically remove that bacterial biofilm that started this whole destructive chain reaction. You're basically disarming the initial trigger.
And it's not just about cleaning either. The treatment also means fixing any little issues that give bacteria a convenient place to hide out. This picture is a perfect example. See that little ledge on the filling? That's a safe harbor for bacteria. By smoothing it out, you take away their hiding spot, which makes it way harder for the disease to make a comeback. Now, for the really tough cases, that deep cleaning might need some backup. This is where you call in the reinforcements, adjunctive therapies. You can use systemic antibiotics to fight the infection from the inside. You can place local antibiotics right into the infected area. And there's even this really cool thing called host modulation therapy, where you use a low-dose medication to basically tell your body's overactive immune system to just chill out and stop destroying things. And here's a really important thing to understand. Winning that first battle isn't the end of the war. Periodontitis is a chronic disease. Managing it is a lifelong commitment. This treatment journey lays out the whole cycle. It all starts with you, at home. Then comes the active treatment, that SRP. After that, there's a reevaluation to see how things are going. If it's still bad, surgery might be an option. But look at that last step, number 5, periodontal maintenance. This is the key. Those regular professional cleanings are absolutely essential to keep the disease from flaring up again. This quote from the source material really just nails it, doesn't it? Success isn't just about what your dentist does in the office. It's a two-front war. You have to eliminate the cause, the bacteria, and you have to reduce those things you can control, those modifiable risk factors, like smoking and diabetes. So we've covered a lot of ground here, right? From the wild fact that it's our own immune system doing the damage, to the things that turbocharge it, and the strategies to fight back. So the real question now is, what are you going to do with this information? If you found this breakdown helpful and you want to keep learning more about your oral health, I definitely recommend you follow the work of Dr. Sarang Suresh. Thanks for tuning in.